For many of us over 60, a simple flight of stairs can feel like a daunting mountain, a barrier to the freedom we once took for granted every day. That hesitation you feel at the bottom step isn't just in your mind, it is a physical signal from your body that needs a new medical perspective. Hello, I am a specialized orthopedic surgeon, and today I want to show you that climbing stairs can become an effortless part of your daily life again. Stairs are more than just a way to move between floors. They are the ultimate test of your functional independence and your long-term joint health. If you find yourself pulling on the handrail or dreading the descent, it is time to look deeper into how your muscles and joints actually work. Today, I'm going to reveal the scientific reasons behind your knee pain and provide a doctor-approved plan to restore your strength and your confidence. Understanding the anatomy is the first step toward recovery, allowing us to target the specific areas that have weakened over the passing decades of life. The pain you feel isn't just getting old, it is often a result of muscle imbalances that we can correct with the right scientific approach today. Imagine walking up to your bedroom or visiting friends without that nagging fear of a fall, or the sharp sting in your knees with every step. We will bridge the gap between medical theory and practical exercise, ensuring that every movement you make is safe, effective, and scientifically backed for seniors. Let us begin this journey together to reclaim your mobility. Your age is just a number, but your strength is something we can always rebuild. According to the National Institutes of Health, the phenomenon known as sarcopenia is the primary reason why climbing stairs becomes so difficult after age 60. After 60, the body naturally begins to shed muscle mass at an alarming rate, losing up to 3% of its total strength every single year. This loss of power isn't uniform. It specifically targets the fast-twitch muscle fibers that are essential for explosive movements like stepping up a high stair. Your quadriceps act as the primary engine for lifting your body weight, but when they weaken, your knee joints are forced to take the entire load. Furthermore, the glutes, the largest muscle group in your body, often go sleepy in older age, leaving your lower back and knees vulnerable to injury. It is not just about the size of the muscle. It is about the brain's ability to communicate and activate those fibers when you need them. Your calves are your foundation. If they lack the flexibility or strength to push off, your entire climbing gait becomes inefficient and very unstable. The NIH research proves that this decline is not inevitable. Muscle tissue can be regenerated and strengthened at any stage of life with proper stimulus. I have seen patients in their 90s double their leg strength in just a few months. Your muscles do not have a mandatory retirement age. Maintaining muscle mass is the best insurance policy you can have for your joints, preventing the bone-on-bone friction that causes chronic arthritic pain. When we wake up these dormant muscles, we take the pressure off the cartilage, allowing your knees to move smoothly without that painful grinding sensation. These three muscle groups are the Trinity of Mobility. If we strengthen them together, the stairs will no longer be a source of physical stress. By focusing on functional strength, we are not just helping you climb, we are protecting your heart, your bones, and your overall longevity. The goal is to move from a state of fragility to a state of resilience, where your body supports your lifestyle instead of limiting it. Now that we understand the why behind the weakness, let us look at the common mistakes that might be making your condition even worse. The most common mistake I see is the forward lean. When you tilt your torso too far, you create massive shear force on your kneecaps. Do not use the handrail to pull your body weight up. This habit turns off your leg muscles and puts excessive strain on your shoulders. When your knee travels too far past your toes, you are essentially asking your joint to act like a hinge with a heavy weight attached. Look at the difference in posture. A straight spine allows the weight to pass through your hips and into the large muscles of your legs. Stomping or landing heavily on the step sends a shockwave through your ankles and up to your lower back, causing unnecessary microtrauma over time. Looking down constantly at your feet actually throws off your inner ear's balance, making you more prone to dizziness or losing your center of gravity. This poor posture doesn't just hurt the knees, it compresses the lumbar discs in your spine, which can lead to sciatica and chronic back pain. Trying to rush or skip steps might seem efficient, but for those over 60, it increases the risk of a catastrophic fall by 400%. If your hips drop to one side as you lift your leg, your knee will cave inward. This valgus movement is a leading cause of ligament tears. Many people fall into the next step when going down. This lack of eccentric control is what causes that sharp pain under the kneecap. You must maintain a solid tripod with your foot. Losing contact with the heel during the push-off phase is a recipe for calf strain. Footwear matters. Climbing in loose slippers or socks on hardwood stairs is one of the most dangerous habits I see in my clinical practice. Tensing your entire upper body out of fear actually makes your legs stiffer and less able to react to small slips or changes in height. Every mistake we've discussed increases the pressure on the patellofemoral joint by up to 7 times your total body weight with every single step. Now that we've identified the enemies of your movement, let's learn the foundation of strength exercise that will change how you move forever. We will begin with a simple but powerful routine. This is the Chassis of Strength program, designed to build stability from the ground up. First, the controlled heel raise. Stand tall and lift your heels slowly. Feel the engagement in your calves. This is your body's primary brake system. Hold at the top for 3 seconds. This isometric contraction builds the tendon strength needed to handle the impact of stepping down a stair. The secret is in the descent. Lowering your heels slowly trains your muscles to control gravity, which is exactly what you need when going downstairs. Now for the step-up mastery. Place your right foot on a low step. Ensure your knee is not wobbling inward. Keep it perfectly centered and stable. Drive through your heel, not your toes. This engages the glutes and hamstrings, taking the shear force off the front of your knee joint entirely. Visualize a string pulling the top of your head toward the ceiling. Avoid the temptation to lean forward. Stay tall, stay proud, and stay balanced. Notice the muscle activation. By moving slowly, we are forcing the muscle fibers to work through their entire range of motion, building real functional power. I am monitoring the lower back here. A neutral spine ensures that the core is engaged, providing a stable platform for the legs to move. The reverse step is the most important part. Do not just drop down. Control the fall. This is how you prevent knee pain when descending. Switch legs. Consistency is key. We are retraining your nervous system to recognize this movement as safe, stable, and completely within your full control. If you need more stability, the wall slide is a perfect alternative. It builds quadriceps strength while your back is fully supported by the wall. Only go down as far as you feel comfortable. Even a small range of motion will begin to strengthen the tendons around the kneecap. Listen to your body. Pain is a signal to slow down, but a burning feeling in the muscle is a sign that you are making progress. To truly master stairs, we must also strengthen the glutes on the floor. The glute bridge is the safest way to build power in your hips. Squeeze your glutes at the top. This exercise teaches your body to use its biggest muscles for the heavy lifting, sparing your smaller knee joints. Balance is the final piece. Standing on one leg for 30 seconds a day can reduce your risk of a staircase fall by over 60%. Focus your mind on the muscle you are working. This neuromuscular connection is what makes an exercise truly effective for long-term functional recovery. Look at the improvement. In just a few minutes of focused practice, his movement has become more coordinated and his posture has significantly improved. You do not need a gym. You do not need expensive equipment. You just need a sturdy step and the willingness to try every single day. The physical part is done. Now, let's talk about how to integrate this into your life safely and how to set a realistic schedule. Your muscles are now awake. They are ready to support you. But we must be smart about how we continue this training at home. Let us outline a clear path forward, a schedule that respects your recovery time while ensuring you make steady, measurable gains in strength. I recommend starting with 3 sessions per week. Your muscles need 48 hours to repair and grow stronger between these focused training periods. Just 15 minutes a day is all it takes. Long workouts often lead to fatigue-related injuries, so we prioritize quality of movement over total quantity. Always check your baseline. If you feel dizzy, short of breath, or have sharp joint pain, stop immediately and consult with your primary healthcare provider. Safety at home is vital. Apply non-slip adhesive strips to your stairs. This simple addition provides the extra traction your shoes need to feel secure. Ensure your stairwell is well lit. Shadows can hide the depth of a step, leading to missteps that are the primary cause of household falls. Remove all clutter and loose rugs from the landing areas. A clear path is a safe path, and it gives you the confidence to move. Wear supportive footwear even inside the house. A shoe with a firm heel counter and a non-slip sole is your best friend for stairs. Hydration and protein are your fuel. Your muscles cannot rebuild without the proper building blocks, so eat well to support your new, active lifestyle. The most important rule is to listen to your body. Some days you will feel strong, and other days you might need extra rest. Adaptability is key. These exercises can be done anywhere, anytime. The goal is to make movement a natural, joyful part of your daily existence. Keep your exertion at a moderate level. You should be able to hold a conversation while exercising without feeling excessively out of breath or tired. Managing your weight is the kindest thing you can do for your knees. Every pound lost feels like 4 pounds of pressure removed from the joint. Track your progress. Seeing how far you have come in just a few weeks will provide the motivation you need to keep going forever. Recovery is when the magic happens. Ensure you get at least 7 hours of sleep to allow your growth hormones to repair your hard-working muscles. We have covered the science, the mistakes, the exercises, and the safety. Now, let us focus on the most important part, your mindset. You are not just aging. You are evolving. Every year you have lived has given you the wisdom to care for your body more deeply. Physical freedom is the foundation of a happy life. It allows you to travel, to play with your grandchildren, and to explore the world. I have spent my career fixing bodies, but my true passion is teaching people how to prevent the need for surgery in the first place. You are part of a growing movement of people over 60 who refuse to be sidelined by age. You are the masters of your own health. I want to hear from you. Please share your age and the specific challenges you are facing in the comments below. I read every single one. I will be personally answering as many questions as I can to help guide you on your journey toward pain-free movement and total stair mastery. Remember, the first step is always the hardest, but every step after that gets easier when you have the right scientific tools in your hands. Victory is not about speed, it is about the courage to keep moving. You have the power to change your physical destiny starting right now. Don't forget to subscribe for more doctor-led advice. We are here to support your health every week with the latest medical insights and exercises. Keep practicing, keep believing in your strength, and stay safe. I look forward to seeing you in our next video. You've got this. Wishing you health, strength, and many more years of walking with confidence. Goodbye for now, and keep moving forward with pride and grace.